In the year 1900, the maternal mortality rate in the United States was approximately 850 deaths per 100,000 births. Put that in terms you can feel. For every 1,000 women who gave birth, nearly 9 died. Not from unusual complications, from ordinary childbirth, from puerperal fever, from haemorrhage, from infections that had no treatment, from the simple act of having a baby. Today that number is 23 per 100,000, still far too high, but a reduction of nearly 97% from where it stood at the beginning of the 20th century. That reduction is considered one of the greatest achievements in the history of public health. What almost no one knows is that before the reduction came, the attempt to improve things made them worse. Dramatically, measurably, catastrophically worse. And the reason it made things worse is one of the most important lessons in the history of medicine that is almost never taught. Most people assume the story goes: women gave birth at home, it was dangerous, hospitals came along and made it safe. That is the version that appears in medical histories. It is missing the chapter in the middle. The chapter where going to a hospital to give birth was more dangerous than staying home. That chapter lasted about 100 years. Before 1800, childbirth was a domestic event, managed almost entirely by women. The laboring woman was attended by a midwife, usually an experienced older woman from the community, sometimes formally trained, more often carrying knowledge passed down through generations of practice. Female relatives and neighbors were present. The room was familiar. The faces were known. This was not safe by modern standards. Women died. Babies died. Obstructed labor with no surgical option was a death sentence. Infection killed mothers who survived the birth. The conditions were genuinely dangerous. But here is the statistical fact that medical historians find uncomfortable. In the mid-19th century, the maternal mortality rate for England and Wales was 47 per 10,000 births, which meant that around 31,000 women died in childbirth during the decade of the 1850s. The majority of those deaths came from puerperal fever, also called childbed fever, a bacterial infection that spread during or after delivery. Puerperal fever was not evenly distributed. It clustered. It concentrated. It appeared in waves in specific locations. Those locations were hospitals. The lying-in hospital, the 18th and 19th century version of a maternity ward, was intended as a humanitarian intervention. Facilities where poor women who could not afford midwifery could receive attended care. Charitable institutions that would bring the benefits of medical supervision to women who otherwise had nothing. What they actually delivered was infection. The mechanism was not understood because germ theory did not yet exist. What was understood, empirically and increasingly, was that women who gave birth in hospitals died of puerperal fever at dramatically higher rates than women who gave birth at home with a midwife. In some hospital wards, maternal mortality from puerperal fever ran as high as 10 to 35%. In comparable home births attended by midwives in the same cities, it ran at 1 to 2%. The hospitals were killing the women they were trying to save. And they continued doing it for decades after this pattern had been clearly observed, because the mechanism was not understood, and the medical establishment did not want to believe that the solution was to do less. The most famous case is Ignaz Semmelweis. A Hungarian physician working in Vienna in the 1840s, Semmelweis noticed that the maternity wards staffed by medical students, who also performed autopsies, had dramatically higher mortality rates than the wards staffed by midwives who performed no autopsies. He proposed that medical students were carrying something on their hands from the cadavers to the laboring women. He introduced mandatory hand washing with chlorinated lime solution. Mortality in his ward dropped immediately and dramatically. He was ridiculed. His colleagues refused to accept that their hands could be killing their patients. The professional and psychological resistance to his findings was so intense that Semmelweis eventually suffered a mental breakdown. He died in 1865, ironically from an infection. His hand-washing protocol was not widely adopted until after Louis Pasteur's germ theory provided a theoretical framework that made it intellectually acceptable to admit what the data had shown for 20 years. The women who died in those hospitals between Semmelweis's findings and the medical establishment's acceptance of germ theory died not from ignorance. They died from institutional pride. Here's the part that changes how you see the shift from home to hospital birth. When childbirth moved into hospitals in the early 20th century, a shift that happened rapidly between 1900 and 1940, driven by professionalization of obstetrics and the promotion of hospitals as modern and scientific, it did not simply import better care into a new setting. It imported a system. And the system included practices that were, by the standards of the time, considered progressive and correct, but which we now understand created new problems. Women were placed flat on their backs in beds, a position that makes labor longer and harder, but was preferred by doctors who were trained to operate while standing. Routine episiotomies, routine forceps, routine separation of newborns from their mothers in the first hours of life, restrictions on who could be present in the room. The clinical environment added antibiotics, blood transfusion capability, and surgical capacity. These things saved lives that would otherwise have been lost. The maternal mortality rate did fall after the 1930s and fell substantially. But the women who arrived in those hospital rooms also lost something that had existed in the home birth system for all of human history: continuity, familiarity, a midwife who had attended previous births, a room where they were not a patient but a woman in her own home. That loss is not quantifiable in mortality statistics, but it is present in every account women gave of what hospital birth felt like in the 20th century. The isolation, the passivity, the sense of things being done to them rather than with them. From 1900 through 1997, the maternal mortality rate declined almost 99%. That is the headline. The footnote is that the first 50 years of that decline happened despite the hospital system in some ways, not because of it. And the women who pushed for midwife-attended birth, for partners in the room, for upright positions, for the return of the practices that had existed before professionalization, they were not rejecting medicine. They were reclaiming what the hospitalization of birth had taken from them. That is the history they do not put in the discharge papers. Not because the hospital system failed, it succeeded profoundly, but because the full story of how it succeeded includes a chapter where the attempt to improve things made them worse, and the people who identified that were dismissed for 2 decades while women died. Subscribe if you want to keep going. Every week, the history that changes what you thought you knew.